chain drug review, and mass market retailers video forum. Brought to you by the Emerson Group.
Hello everyone, I'm Jeffrey Wold, Editor-in-Chief of Retail Media IQ. Welcome to our video forum. Today we're thrilled to be talking with Anna Cespedes, CEO of Vitamin Angels. Anna, good to see you.
Jeffrey, thank you so much for having me with you. It's a pleasure.
Let's begin. You're reasonably new to your job. You've been in place at Vitamin Angels for about a year. Maybe you could tell us a little bit about yourself and then a little bit about the mission of Vitamin Angels.
Yeah, absolutely. So I am a pharmacist by training. I have a PhD in food science, a master in general management, and my passion is access to innovation. That has been the theme through my career in biotech, in pharma, in vaccines, and now in nutrition. Vitamin Angels is a global health organization dedicated to improving health of women and children most at risk through proven nutrition solutions. And that includes saving lives in some cases. There are 1 billion women and children with micronutrient deficiencies in the world. This is 1 out of 3. So this is where we work, preventing anemia, poor birth outcomes, impaired development, and preventable deaths. And we are able to reach 74 million women and children every year in 65 countries. And this includes the US, Jeffrey. We work in the 50 states in the United States, including Puerto Rico as well.
And maybe you could tell me a little bit about where Vitamin Angels support comes from. How are you able to do that great work?
Significant part of our work comes from the vitamins and supplements industry. We love this industry. We hope to be very good representatives of this industry, and many organizations in the industry support us. We also have the support of other global health organizations and donors in the global health space. The Church of Latter-day Saints, Care Humanitarian, and big philanthropic organizations also support our work at large scale.
And you do partner with retailers, particularly Walgreens, I know, has been close to Vitamin Angels.
Yes, retailers are critical partners to us. Our partnership with Walgreens has been in place for 13 years. Our partnership with Vitamin Shop has been in place for 20 years. Fresh Thyme, Whole Foods. Retailers are particular great partners to us because through them we are able to expand the value of vitamins to a great population.
Maybe you could talk a little bit about the business opportunity that exists in maternal health and what retailers can do for their customers to support them on their wellness journey, but also perhaps to help their bottom lines as well.
Yes, maternal health is not a niche issue. So every year, globally, we have 140 million kids being born. In the United States, this is 3.6 million babies, million births occurring. So this is a topic that is very close to consumers, and this is a particular moment in our lives. So this is a moment where we care especially about the type of products we consume, where we are especially alert of the information around this. Retailers, Jeffrey, are in the intersection between health, trust, and daily consumer behavior. So that makes retailers play a very special role in these moments in life. And supporting maternal health, we know consumers not only care about the brands, but they also care about the brands making something meaningful and measurable. Like when you make big statements that are not supported by data, that sounds like a little bit of marketing. Consumers like to partner and to buy products from those organizations that really care about societal issues. So we think, and our experience demonstrate that supporting maternal health is seen by consumers as an opportunity to increase the credibility on those places where they are buying from, those retailers. And there's enormous power to democratize access to health from the retailers in these moments.
And I suppose in the long term, the dynamics you just talked about help build loyalty to those retailers.
Yeah, exactly. So we know that consumers, particularly during certain moments during pregnancy, and they increase like up to 4 times the search for information. And when you find high quality products and when you find spaces where you get high quality information about, for example, the value of prenatals during pregnancy, or the value of certain types of supplementation or certain types of foods during early years in life, early development for children, you become close to those brands and those spaces where you find this information. And we have experiences working with retailers that are really beautiful, where consumers just say that they go to these places because they like the collaboration and the impact that they make in populations around them.
Could you cite a couple of examples of programs that retailers have put in place that have been particularly effective?
We have a prenatal program with Walgreens that, in my perspective, is one of the leading examples on how you can bring value to the communities that are your clients and increase in these communities the number of customers. So through this partnership, it's called Prenatal Vitamin Program, we are distributing free prenatal vitamins to those mothers or those women who can't access them. As an example, in the US, 10% of Black women have access to prenatals, 90% don't. So through this partnership with Walgreens, the need is estimated about 1 million women in the US have access to vitamins they can't afford. So through the partnership with Walgreens, we're able to reach 500,000 of those women in the 50 states. And we don't only provide the vitamins, we also provide the knowledge about what these vitamins do for them, but also for the babies. It's about brain development. It's about immune system development. It's about starting the life with a health that we later on continue to build over years. So we feel super proud. I am now visiting stores. I did like 20 stores, talk to the cashiers, talk to the store managers. And what I love is, how these people connect to their customers in a simple conversation. Hey, do you want to donate? What is this for? That's the question, right? And as well, this is for vitamins for pregnant women. And then it's a conversation around the power of vitamin supplementation. I am super thankful to those people, thousands of people contributing right now.
You mentioned the importance of knowledge and the power of communication. What more should Vitamin Angels, retailers, suppliers be doing to talk about the importance of supplementation and also help customers sort through the myriad options that are available in the market?
I am passionate about prevention. I'm a pharmacist, as I said, and there's significant value in drugs and equal, if not more, value in prevention. Like 70% of the diseases nowadays are preventable. And this is about nutrition, it's about healthy lifestyles, exercise, mental fitness, social relationships, educating in prevention, and simplifying. There's an opportunity to simplify. We don't have time. We need simple messages. If you are in menopause or if you are in this period, those are normal deficiencies, high percentage of population with experience. And then from there, you can take a deeper conversation, simplify, listen to consumers, and also differentiate between claims that might not be sustained by evidence and those that are. There's a lot of evidence in the power of vitamins, minerals, or supplements for better health.
And a final question for you. How would either a CPG company or a retailer or anyone else for that matter that wants to be part of this movement to work with Vitamin Angels, how would they go about that?
I love that you call this a movement because this is how we feel. Vitamin Angels is a network organization. We have about 1,000 partners in the world. And what we do is, number one, listen to each other. Tell us what you care about. Tell us your passions. What is your mission at the core? Is it children? Is it women? Is it prevention? Tell us. Let's talk. Build a shared goal. That's number one. Second is let's build one team. It requires time. For example, stores have the opportunity to have signets, to talk to cashiers. When we are able to educate those cashiers and talk to them, or at least the store managers, we can communicate directly what we do. We have the knowledge on the scientific programs, we have the materials, we have the expertise, and we know how to measure outcomes. That would be the third thing. So share goal, build one team, and measure outcomes. It's not about statements. It's about facts. People like the data and what this investment is making. There is no one size fits all. Sorry, it's building a true partnership. Every organization we partner with is a unique partnership built in such a way.
Well, you're doing great work, and we appreciate you filling us in today. Good luck, and thank you.
Thank you so much.